So I pulled there were so many quotes as I was reading this book. I was reading it on Kindle, and there were so many quotes, and the highlight feature is almost too useful because I highlighted so many quotes that I thought really articulated things better than I would be able to say them. But there's one quote I want to read here. It says, "Whether we call a drug medicine or regard it as a form of recreation or try to harness its effects to improve our lives, what we refer to in this book as enhancement, it makes no difference to the molecules in question. They work on the brain however they work and produce whatever effects they produce, good, bad, both, or in between. Often the legal or medical status of a drug has more to do with quirks of history or politics than with a sound understanding of its actual benefits and risks. Does a drug-induced mood lift count as medicine? If you suffer from depression and got the drug from your doctor, yes. If you don't suffer from depression and got the drug from your dealer, no." So, on that note, I'll ask you, what do you think is the biggest preconception about drugs, medicine, whatever you want to call it?
I think people think about a lot of things in terms of the categories we use to make it easier to talk about them in a simple or more efficient way. So people talk about social categories this way, they talk about identity categories this way, and we talk about the natural world this way. So when we refer to chemicals out there, rather than giving an exhaustive description of each one and everything we know about it, and it can be used for this and it can be used for that, we tend to just refer to the chemicals in terms of our intended use. So we'll often call certain kinds of chemicals medication. An example of this is selective serotonin reuptake inhibitors, which is a drug that's prescribed most commonly for treatment of depression. And the issue here is we often just refer to this drug as antidepressant medication because that's what it's mostly used for. It can also be used to treat other things like obsessive compulsive disorder, some forms of anxiety, and so forth. But the point is that selective serotonin reuptake inhibitors don't know, quote unquote, that they're supposed to be acting on depression or on any other high level feature of our mental life. They're just doing whatever they're doing in our brains. And the problem with the current paradigm is that scientifically, when we intend to use a drug for a certain purpose, we tend to only measure things that are pretty closely related to that purpose. And that means that we may be missing out on understanding not just the usual side effects of drugs, like does it increase the chance of nausea or does it affect your sex drive or something like that, but how does it affect all sorts of other things about our mental life? And also, how does it affect our interpersonal relationships, which is probably the least studied side effect of all.
Talking about how drugs like SSRIs affect your interpersonal relationships, that's not really something that's spoken about in the medical field. But it's important to be aware of it if you're taking your SSRIs because it affects your personality and it affects your makeup.
Yeah, and one and the same drug can be thought of as having either a main effect or a side effect depending on what you're using the drug for. So I use the example of amphetamine-like drugs that are often used to treat narcolepsy, which is where you have a tendency to fall asleep at inappropriate times. And they have this effect of causing heightened activity and alertness and so forth. And a common side effect of this drug is that it can suppress appetite and so forth. And so there, the side effect is that you might induce weight loss when that's not what you were looking for, but it has the main effect of helping you stay awake. But then for other people, that very same drug can be used as a weight loss drug, which has the unfortunate side effect of causing sleeplessness. And so it's just the same drug, it's just an amphetamine, and it does whatever it does, but the side effect and the main effect just switch depending on what you're trying to accomplish.
And if somebody were to take one of those drugs intentionally for weight loss, it would be looked at by society as, oh, that's kind of unethical. Is that immoral that they're using that drug for weight loss? Whereas somebody else might be taking that drug and they're just lucky that they get that particular, I don't want to say lucky, but yeah, they're kind of lucky that they get that particular side effect. And then so much of the question comes down to what was the intention of taking
Well, exactly.
that
And it
drug?
also depends on your values. I mean, some people aren't aiming to lose weight if they're already thin or they're happy with their body, and weight loss might be an undesired side effect. But for people who are struggling with weight loss, then it could be a desired outcome of the drug. And so, again, it's not only what are you intending it for, but also what are the surrounding values? What are your preferences and desires? And that's something that, again, it's hard to put that on the side of a bottle as a general risk, because the role that any given drug will play in our lives is going to be heavily shaped by our particular relationships, our particular values, our particular commitments. And so it ends up being a very fine grained kind of analysis that you have to apply about whether the use of a given drug in a given context would be, all things considered, a good idea.